Hello everyone, I'm Dr. Y. Coney and welcome to Bright Star Baby and Child Clinic. In this video, I would like to talk about starting solids in your infant. Now, starting solids is a big milestone for your baby, right? And there are many opinions from family and friends, well-meaning advice and opinions, but sometimes it can get rather confusing. So, in this video, let's clear the air about starting solids in your child. And hopefully, after watching this video, you'll gain some confidence and enjoy the process of starting solids with your young one. Now, firstly, how do you know if your baby is ready to start solids? Remember that each child is different and every child goes at his or her own pace. But here are some signs of solid readiness in your child. Can your child hold his or her head in an upright position with good head control? To eat solid food, an infant needs to be able to hold his or her head upright and have good neck control to avoid choking. Can your baby sit with support? A baby who's ready for solids can sit in a high chair or a feeding chair without sort of slumping to the side, without slumping down. Is your baby interested in food? A baby who stares at your food and grabs at your food, opens his or her mouth when food is near, and appears eager for food, is most likely ready for solids. Can he or she move the food from the spoon to the back of the throat? Now, babies are born with a reflex that makes the tongue push food out of their mouths to prevent choking. This reflex is called the tongue thrust reflex. Most babies lose this reflex around 4 to 6 months of age. If they can move the food from the spoon into the throat and swallow it, that means they are most likely ready for solids. Is your baby big enough? Generally, when an infant doubles his or her birth weight, typically at around 4 months of age, or if they weigh 6 kilos or more, they may be ready for solid foods. If the answer to those questions are mostly yes, then your baby is most likely ready for solid foods. Generally, it is advisable for babies to start solids around 4 to 6 months of age. Try not to delay beyond 6 months of age. Studies have shown no benefit in delaying the start of solids beyond 6 months. So, what are the foods to start and how? Now, it is important to remember that your child should start with a single ingredient food, meaning a single food, and observe for about 3 to 5 days for any reactions before moving on to the next single food. And this is to monitor for allergies. You should watch out for reactions such as rashes, hives, swelling, vomiting, diarrhea, or if severe, bloody poo or difficulty breathing. After your child has tried a variety of single ingredient food, you may start combining them once you know that they have no allergies or no reactions to single ingredients. You may start with simple cereals such as iron-fortified rice cereal, barley, or oatmeal. Start with about 1 to 2 teaspoons, and once your baby gets used to it, or if he or she wants more, you can gradually increase the amount as well as the frequency of feeds. Your goal is actually to reach a target of 3 meals plus 2 snacks a day. How fast or how slow your child reaches that target is totally dependent on him or her. You may also gradually start adding single ingredient fruits, vegetables, and pureed meats. These foods should be cooked until soft and easy to swallow. The food texture can be gradually chunkier or coarser depending on your child's preference. By about 8 months, babies can start handling finger foods such as soft fruits, soft vegetables, cheeses, cooked meats, crackers, and melty dry cereals. Now, how do you know when your child can start finger foods? Once your baby can sit up and bring his or her hands to her mouth, you can start giving finger foods to help him or her learn to feed own self. To prevent choking, make sure anything you give your child is soft, easy to swallow, and cut into small pieces. Some examples include small pieces of banana, wafer melting type of cookies or crackers, scrambled eggs, well-cooked soft pasta, well-cooked finely chopped meats, and well-cooked cut-up potatoes or peas. Now be sure to give iron and zinc containing foods such as fortified cereals or pureed meats. Now we know that some babies will reject or spit out the foods that you give them. That's okay. Do not be discouraged. Wait a while and try again. This is just a time to experiment. Now remember that your baby is still getting most of his or her nutrients from formula milk or breast milk. Do not feel discouraged if at first they do not seem to want to eat solid foods. Try again. Go slowly or at whatever pace your baby dictates. Some babies eat faster, some babies eat slower. Always watch your child and monitor your child while he or she is eating to monitor for signs of choking. Here are some things to note that are important. You should provide a variety of foods for your baby and not just focus on rice cereal, as there is a potential risk of arsenic exposure or arsenic poisoning if your child is only given rice cereal. Please include all grain types that are fortified with iron, such as oatmeal, barley, or multigrains. Babies less than 1 year old should not be given honey, as it contains spores that might lead to botulism in your child. Regular cow's milk or fresh milk should not be given in an infant less than 1 year old, as it doesn't contain enough nutrients that babies need. Do not offer foods that can be potentially a choking hazard for your child, such as hot dogs or chunks of meats or big pieces of cheese, grapes, raw vegetables, or large fruit chunks, unless they are cut into small pieces. Also, try not to offer hard foods that are hard to swallow, such as popcorn, hard candy, nuts, seeds. These hard foods need to be ground up before offering to your child. They should not be given whole because their hardness makes them a potential choking risk. Other high-risk foods include big spoonfuls of peanut butter or large chunks of marshmallow, as these may block the windpipe of your child. If you want to offer your child these foods, for example, peanut butter should be spread thinly on a piece of maybe a melting biscuit or a piece of soft vegetable. Now make sure fresh foods that you prepare for your child are clean and not spoiled. Do not give a baby less than 1 year old foods containing added salt. In general, even if they are older babies, avoid giving overly salty, fatty, fried, sugary, or overly seasoned foods. Actually, this theory applies for adults as well. Now, what about food allergies? I'll list down some potentially allergenic foods, and they include peanuts, tree nuts, soy, wheat, eggs, dairy or cow's milk products, shellfish, and fish. There is no evidence in delaying the introduction of these allergenic foods. In fact, studies have shown that by introducing these foods earlier, it may reduce the risk of food allergies to these potentially allergenic foods. For example, one of the studies is that early introduction of peanut may decrease the risk of peanut allergy in a healthy child. However, if your child or a close family member have severe eczema or asthma, then you might have to be cautious about starting some of these foods, particularly peanut or eggs. Please talk to your pediatrician if your child or close family members have severe eczema or asthma. So I hope this video helped you understand more about how to start solids on your child. Please know that it is a time of experiment and enjoyment, and it is also a time for your child to foster good eating habits. Learn to enjoy the process and do not be afraid to be adventurous. Thank you for watching this video. Meanwhile, stay safe and take care. Bye!